Welcome to Two Pete's in a Podcast, where we will talk about child health from birth right away through to adolescence, dealing with issues of illness, development, and everything else that is of importance.
Good day. This is Dr. Ismael Patel. This is Two Pete's in a Podcast, and we are continuing our chat on tonsillitis. With me, I have Simon Strawn.
Morning, everybody.
And we have Dr. Ismael Patel back in the seat with us.
Morning, everyone.
Hi. All right. So last week we spoke about tonsillitis, what it is, where it is, what it does, what it causes, but we cut short and we needed to go into the actual surgery. So that is our plan today. We're going to be talking about why we do surgery, what happens in surgery, and the complications and treatments and all the different things around that. And I think when we discussed this, we thought, let's take it from the day that your child arrives in hospital to have the tonsillectomy. You agree?
Absolutely. So we've got to the point of going, we've been through all the medical treatments, we've seen Dr. Patel, and Ismael decided your child needs to have a tonsillectomy. So perhaps walk us through that, Ismael, from the point of, let's talk about the day. What do parents need to do to prepare for the day, and then talk us through that?
The most important thing, even in today's times, is still to understand pre-operatively, we still would ask the parents not to give, there's still a myth and a tendency to think that they could give medications that could prevent any swelling and things. So the first thing, before you even arrive on the day of surgery, if you're taking any kind of medication that you would be told about, be it herbal or any other that would reduce swelling and reduce pain, please do not use them, because many of those things have properties where they actually can cause your child to bleed. So
Arnica specifically, eh?
Yes, Arnica specifically, and some of these new gummy vites and things like that, they all tend to cause or increase the amount of bleeding intra and post-operatively in some patients.
And to avoid them just for the day before surgery is enough?
Yes. On the day, the way we normally would schedule a day is from the youngest to the oldest. Obviously, naturally, because the youngest would get hungry a lot quicker. And so even the starving times in terms of them starving the night before would be determined in terms of age. So if your child's being breastfed, we would say 4 hours for breastfeeding. And if your child's on solid foods like milk or anything like that, it would be a minimum of 6 hours.
Nothing through the mouth for 4 hours before if you're breastfeeding, or 6 hours before if you're on any other formulas or food.
That has changed, Simon, slightly. So before we used to say nothing. Now we say solid foods, breast milk 4 hours, any kind of formula milk or anything like that for over 6 hours. But today, however, there's new evidence that suggests that liquids, like clear liquids like apple juice, water, you can do it as close as 4 hours, and some centers around the world even as close as 2 hours before the surgery.
But we're talking about little sips to keep your child comfortable. You wouldn't want a child to drink a whole 200 mils or something 2 hours before surgery, or is that not the case?
That's not the case. In fact, now you can drink to your full, but about 4 hours before or 2 hours before, it seems to make no difference.
Very interesting. Okay, so now they've been admitted, they've gone through reception, they've gone into the pediatric ward. So what happens from there? And they've obviously been starved because they come in on the day.
Yes.
They don't come in the day before. So from there, they're waiting for theatre, and then they get called to theatre.
Well, the anaesthetist will come first, eh?
Yes.
Yes.
So that's important to understand. A lot of these kids come in quite anxious. It's an anxious day. It's an anxious environment, and the older kids actually understand what's going to happen. So it's important that the anaesthetist see all of them. So just to give you a very quick rundown, what do we find in the young kids? In the young kids, usually they would be picked up, but sometimes they could still have an underlying infection, and in that case, we would postpone, because if there is an underlying infection, so the anaesthetist would go through that. They check check for fever, tachycardia, which is an increased heart rate, or they'd see if there's anything of concern, including a chest infection, that may preclude us from operating. And today, the big difference, so there's two methods about doing this. Pre-surgery before, we used to just give basic medications. Now we are using a very specialized drug that is used in theater. It's called Presidex. And this was specifically used in theater because it lowered your blood pressure, and basically, what it did is when you woke up, you didn't wake up with this arousal delusion that most people wake up with. However, in my practice, I have two sets of anesthetists. One set of anesthetists prefer to use it pre-operatively, where it sedates the child. The child literally comes into theater unaware that they're actually coming into theater. And I've got another set of anesthetists who prefer to use it precisely for that reason, intra-operatively. So when the child wakes up, they wake up a lot more comfortably, not crying and not hysterical.
And often the hysteria and the crying post-operatively is not because of the pain, it's because of the effects of the anesthetic gases that they use. So this Presidex is used just to dampen down that response.
Yes. So now it's becoming more important to tell the anesthetist, how does your child fall asleep? How does your child wake up if they have had a procedure? So now we can actually tailor the anesthetic as well to make it as comfortable as possible for the child, and so that they don't remember any of the negative effects that they could have an anesthetic.
Okay. So now they're in theatre. Are the parents allowed to come in with you?
In my practice, again, we allow one of the parents into theatre. For a few reasons. One is the child feels very, very comfortable. If the child is sleeping, it generally doesn't feel like it's being disturbed. And also it helps to settle the parents who are as anxious as their kids. So what would happen is they arrive in theatre. The anesthetist would sit them down with their child on a chair or on the cot if the baby's still on the cot. And we would induce or put the child to sleep by using an anesthetic gas.
Okay. And I want to just make a point here because I've seen it happen. The parents need to understand if they're sitting holding their child while the child is put to sleep with the anesthetic gas, when that child falls asleep, they would never ever have experienced how floppy and unresponsive their child is in their arms. And I've seen many parents get a huge fright as it happens. Is that your experience?
Yes. So the first thing that happens is there are various stages of anesthesia, and it happens even during all of us when we go to sleep at night. But because it's a gradual onset, we don't tend to notice it. In an anesthetic, we literally bring this on within seconds to minutes. So you go through the various stages, and at one stage, the kids start to fight and become a bit aggressive, and the parents get worried that something's going wrong. In fact, that's one of the stages of the anesthesia. And then immediately after that, this is what Simon's talking about. They literally go limp from suddenly fighting, and the parents often wonder, has something gone wrong? No, it's just the various stages that happens every night when you go to bed. We just doing it just much faster to get your baby asleep.
And so if you're lying next to your child when they're falling asleep at night, they have what we call sleep myoclonus, where they start kicking their feet or kicking their arms. This just happens, like you're saying, much more concentrated.
Yes, and much faster.
And then they get paralyzed.
Yes.
Because they're in sleep.
Yes.
Very interesting. All right, so I think we're running a bit long on time with this one. So let's break there, and we'll carry on in the next episode with the continuation, like when we're in theatre. If your children have allowed you to,
thanks for listening.
Thanks for joining us, Ismael.
Thanks, guys.
Thanks for listening. If you found this of value, please be sure to sign up to our email list at www.careforkids.co.za, and that's the numeral 4, and subscribe in your favorite podcast app or follow us on Facebook.
At 2 Pete in a Podcast.
At 2 Pete in a Podcast.
TWO, not the numerical 2.
This is our disclaimer. The information we have given you in this podcast is our own personal professional opinion. We're giving it to you for your own information. Please don't use it to treat yourself or to treat anybody else. Rather, go and see your own medical healthcare provider and follow their advice.